The Family Medicine Residency program started in 1997, and it started off with a very small number of residents. And we've been able to add more faculty over time and also add more residents as time has progressed.
We are a community program. We're based out of Community Hospital Pomona Valley, and there are 8 residents in each class. The program is 3 years long, and they are trained in a robust curriculum of inpatient medicine, obstetrics, gynecology, outpatient medicine, and continuity clinic.
We strive to combine the very best elements of family medicine. Graduating from this program, you will definitely become a very competent, strong clinician. However, we also want to focus on helping you develop the skills, giving you the resources to become a community advocate, a physician leader. And we try to do this in a supportive, inclusive environment.
We prioritize the resident experience. We want to make sure that the residents are safe, that they know they're valued, and they know that we care about them.
I pride our program on being flexible in the sense that we like to support residents in whatever interests them and what is going to drive them.
Pomona is very dedicated to the community. It's quite a diverse community, and so that relationship is very special.
The program was actually started with a mission to repopulate the community with physicians that mirror the community and had a passion and commitment to the community.
We want to prepare physicians to meet the needs of the community, to be not only culturally competent, but to be compassionate and to have a strong foundation of clinical skills to be able to assist their patients and to be able to help their patients out there in the community.
We are committed to our community. We are an unopposed program with a robust curriculum, and you will get a full spectrum training here. We have supportive faculty, supportive residents and staff to help you succeed in the future.
I chose Pomona Valley Hospital because I remember my interview day. So I got to interact with a lot of the faculty and the residents, and they just seemed very genuine, very kind. And I remember having a smile on my face because I knew that I wanted to work with them. I knew that we had connected.
Really what drew me was initially the leadership. My conversation with Dr. Diamond, who was the program director at the time, was just really amazing. I could tell just from our conversation that she really cared about the program and about the residents and the quality of the people coming in.
For me, coming to Pomona was mostly about the community that it serves. And I feel that the mission of the hospital, the mission of the Family Medicine Residency program is diversity. It's what led me to come here as well.
Pomona reminds me a lot of where I grew up. Very diverse, underserved community, and having been a patient with language barriers with your physician, it was very important for me to be able to give back to the community, helping people in the same situation that I was in when I was a child.
Very diverse when it comes to culture, diverse when it comes to ethnicities and just different socioeconomic backgrounds. And I think even right now, I'm able to learn about the beauty of all these differences in the population, but also it allows us to be exposed to different pathologies as well.
I wanted to be in a program that is full spectrum and unopposed, where we are the only residents at the hospital really, and the training that we get is always hands-on.
They're very committed to educating people that are socially conscious family medicine physicians. They're also very committed to just having a broad spectrum training for family medicine. That's something that I definitely wanted to be a part of.
I'm happy to be at Pomona Valley Hospital because I really believe this program is going to educate me and help me get to where I need to go.
I've been able to find everything that I'm looking for here, working with the community that I wanted. Really broad spectrum training from inpatient to OB, family medicine to geriatrics, to behavioral health.
If you just wanted to come straight out of residency and practice the full scope of primary care, you'd absolutely be qualified and ready and prepared from infanthood to geriatrics.
Coming out of med school, I had a very broad training. It was a 6-year medical education that included disaster medicine, internationalism, and I really wanted to hold on to those skills. I feel that Pomona Valley has really prepared me for really any situation.
I like that in this particular program, you can get a really well-rounded education, but you can also do your tracks to specialize.
And if you have any new ideas for any of the program, they're always willing to work with you and willing to make that happen for you. If you're interested in creating a certain track, if you're interested in creating a certain event, you will always feel supported.
I also have a special interest in border health, and I found that the location where this program is allows me to do a lot of that work as well on my free time. The program has been very supportive of my work down there, and I really appreciate that as well. In this program, we have many different tracks, which I feel also make this program very attractive, at least for me. We have the underserved track, we have the sports medicine track, women's health and gynecologic track, the OB track, the geriatrics track, and there's a little something for everybody. And I am currently in the underserved track, and in this track, what we focus on is in more community engagement.
A lot of our patients are working class, working poor. There's a lot of indigent patients in our community, and we need to have an outreach to them. And so that's been the purpose of our underserved track.
I really absolutely love working with the sports medicine leaders. Dr. Ajadi is a sports medicine physician, and he's team physician to, I think it's 5 area colleges, as well as the Agua Caliente Clippers down the street here. I had the chance to go with him to a couple of those games, and it was amazing. We got to sit courtside and take care of the athletes at halftime. I learned a lot about kind of what happens behind the scenes when you're an actual team physician.
A resident who wants to hone in on their musculoskeletal exams will do well in the sports track. They don't have to be an athlete. They can come to the track and learn how to become better family medicine physicians in general, because we usually see a lot of musculoskeletal conditions anyway. So the track actually helps them become better physicians.
Our hospital is one of the busiest in terms of women pathology or deliveries. And so by that, there is also a larger opportunity for residents to learn.
I decided to choose the gyne track because I'm very passionate about women's health, and 70% of my patients are women. And I think we're able to just develop this really deep connection and talking about sensitive topics like contraception or intimate partner violence, or perhaps just trying to get pregnant. So I'm really looking forward to doing this in my rotation in the gynecological track.
We are blessed compared to other programs nationwide that we have enough obstetric to train our residents to be hands-on. We set the standards to graduate family doctors to do the basics of obstetrics, low-risk obstetrics. However, we have definitely tracks for those who are interested to do more of a high-risk obstetrics or even surgical obstetrics.
The average resident in this program gets enough geriatrics to actually do a very good job taking care of people who are over 65 when they go into practice. So if you want to go into the track, the key is that there must be something else you want to learn. And it may be academic, so they give lectures, they run a journal club, they go to the American Geriatric Society conference every year, and then most of them go on to apply to geriatric fellowships.
As the Director of Behavioral Health, one of my primary responsibilities is ensuring that our resident well-being is addressed and being considered. We offer a support curriculum that happens throughout the year. We have an intern support group where we talk about what's it like as a first year, how do we navigate that, what are the challenges, the opportunities, and if there's certain things that are stressing you out in that moment, we talk about it. We have a senior support group. We talk about patient interactions, we talk about leadership, we talk about the day-to-day, how are things going. If our residents need more intensive support or therapy, that's available to them at no cost.
The relationship between residents and faculty in this program is very tight, very strong. The mentoring is very prominent, and there is an open door policy.
There's always a chief resident who is available for discussions of whatever concerns come. There's always then the faculty members that all of them are open to see any issues with the residents. The door from the program director is always open as well.
They're always there to support you whenever you need them, not just in terms of family medicine, but also in a personal matter.
We can talk about my future goals. We can talk about any complex patient I might have, anything that might be going on in my life. And we also have advisors. Each of the residents have advisors. So that's a really nice way for us to discuss our well-being, to make sure we're interacting with our family, our friends, and that we have a life outside of residency.
As a woman of color in particular, I do feel like I was really supported at this program, and no one was afraid to ask me the difficult questions or to attack certain issues that are specific to people of color and communities of color in medicine as well.
Everybody's super open to teaching and just being there for each other. And then as well, the residents are the same. That mentality of support trickles down among the ranks.
For me, with my class, we are extremely close with each other. We have a chat group. We talk almost every day about different topics, and it's a very supportive class. These are bonds that you build. For me, it's going to be for the rest of my life. These people are like my family. My 2 years that I've completed here at Pomona Valley have been really enjoyable, despite the demanding hours a residency can have. Living here in the Inland Empire, in SoCal, in LA County, I found that we're in a very, I would say, privileged area to have mountains close by for those that like hiking, running, outdoor sports. For those that enjoy the beach like myself, I went to med school in Cuba. I needed to have the beach close by.
It's close to San Diego, it's close to LA, and it's just a great way for me to be close to my family.
It's sunny California, and if you're coming from somewhere like Chicago, it's a beautiful city to be in.
I myself have an interest in plants, and there are all kinds of botanical gardens and cool museums you can go to. There's Disneyland, there's the beach, there's mountains, all within driving distance. Everything's, about an hour away. And the food is amazing. There's so many great places to eat too. It's a great place to live.
I think residents that are successful here are those who are passionate and driven, and it doesn't necessarily need to be in one specific area. It could just be passion and drive for family medicine or serving the community.
Someone who's interested in full spectrum family medicine. If you want to know how to do everything and not feel limited as a physician, this is the place.
A happy person is one of the first things. Somebody that has discipline, that is involved with the patient care, somebody that wants to be a team player. We have a pretty strong relationship between us, so we want somebody that can be part of a big group, a big family.
We really try to emphasize in looking for residents and attracting residents that want to work in this community, that understand the vulnerable population that we serve as well. We want good team players, residents that can speak different languages, or if you only speak one language, be willing to learn a new language.
We have a lot of people in the lower socioeconomic status, but they deserve the same kind of care that anybody does. And so if you're willing to learn, and if you're willing to do what you have to do to make sure that you're educated and prepared to take care of those people, and if you're willing to become part of a family where you can be supported and where you'll be expected to kind of return the same favor, then you'll be great here. It'll be a perfect fit for you.
For those of you interested in family medicine, I highly recommend our program, Pomona Valley. If you're looking for great training that is unopposed, where you have hands-on experience in every single rotation, if you're looking to work with vulnerable populations, if you're looking to learn new things, to learn about harm reduction, to learn about different cultures, to be in a great working environment where everybody's a team player, to work with a faculty that's just the most supportive that I've ever seen, then you really need to consider Pomona Valley Hospital.
You can be what you want to be here. You are not going to be hemmed in. You can develop yourself in the way you want to develop.
Whether it's inpatient medicine, whether it's outpatient medicine, when it's mental health concerns, whether it's labor and delivery or OB-GYN, whether it's sports medicine or geriatrics, our residents leave here feeling comfortable to address these concerns. That's our goal. Beyond that experience, the diversity of our residency, the diversity of experiences, of peoples, that is what makes our residency unique.
I felt over-prepared. The fact that I could do my own procedures, the fact that I could do prenatal care and OB, that I could help manage hospice patients or do palliative care. People were certainly impressed that I got that all out of one residency program.
I feel very comfortable basically managing a little bit of everything. I'm ready to go outside and start practicing as a family doctor by myself.
I look back and I've seen the growth in terms of knowledge, in terms of more confidence in speaking to my patients, and also just growing as a better doctor, as a better resident, as a better person.
If you are looking for an experience, well, you'll be supported, you'll be encouraged, You'll be pushed. You want to be the best physician you can be. And this program is really going to help you do that.
If joining a program that is supportive, that is inclusive, that is embracing, that values your opinion, that allows you to have significant input in residency decisions, then this is a program for you. If you find that community engagement is important to you, if you find that developing strong physician leadership skills is important to you, then this is a program for you. If you desire to work at community health clinics, want the exposure to our most vulnerable people in our community, then this is a program for you. If you see Pomona as a place that potentially you could create roots here, then this is a program for you.